Every year, nearly 300,000 people die from drowning. Over 90% of these deaths occur in low and middle-income countries, marking it as a critical global health challenge. Children are the most vulnerable. For those between the ages of 5 and 14, drowning is now one of the top 10 leading causes of death worldwide. While many associate drowning with swimming pools, the primary hazards are found in rivers, lakes, flood zones, household water storage containers, or open wells. To combat this, the World Health Organization has released the PROTECT framework, a set of 7 evidence-based measures for communities. Please grab a pad and paper so we can build a version of this plan for your area. Start by identifying the specific water hazards in your own community. Write down the locations of nearby canals, open cisterns, or seasonal flood zones that people interact with daily. Drowning is often viewed as a series of random, tragic accidents. However, when we look at how these specific hazards overlap with a lack of barriers or training, a predictable pattern emerges, one that can be mapped and managed at the local level. Write the acronym PROTECT down the side of your paper. The letter P stands for physical infrastructure. Based on the hazards you just listed, write down one physical barrier you can implement. This might involve fencing off a community pond or installing a secure cover on a local well to keep people and water separate. R stands for rescue and resuscitation. Physical barriers are first line of defense, but they must be backed by people who know how to respond to an emergency. Note down who in your community requires training. You will need to differentiate between basic CPR for bystanders and specialized rescue techniques for professional emergency responders. O represents occupational safety, focusing on the adults who work on or near the water every day. Draft a basic safety standard for these workers. If your local economy involves fishing or docking, identify the specific equipment and safety protocols required to protect those laborers on the job. Combining these physical barriers with a network of trained responders and clear workplace standards establishes the baseline protection needed to reduce both accidental immersions and workplace fatalities. The letter T stands for transport safety. Routine travel over water presents a constant risk that requires structured oversight. Write down a non-negotiable policy for local water transit, specifically mandating life jacket usage and setting clear safety standards for every vessel. E stands for education, which is our primary tool for protecting that high-risk 5 to 14-year-old demographic. Outline a program to teach basic swimming and water survival skills to local school children, ensuring they understand how to stay buoyant and recognize dangerous water conditions. C stands for childcare systems. Evaluate your local daycare centers to ensure they have safeguarding policies that prevent young children from wandering toward open water. Effectively protecting a community's most vulnerable populations requires a shift toward proactive education and strictly enforced safeguarding policies. The final letter is T for threat preparedness. This covers the ways our local environment is rapidly changing. Climate change acts as a risk multiplier. Frequent extreme weather events and floods create new drowning hazards in areas that were previously considered safe. Rising baseline temperatures also contribute to the danger, as heat waves drive more people to seek relief in open, unmonitored water. This chart shows research from the United Kingdom proving that drowning deaths increase by 7.2% for every 1 degree Celsius rise in temperature. On days when temperatures exceed 25 degrees, the risk of drowning becomes nearly 5 times higher than on days below 10 degrees. Draft your final action item, an emergency preparedness plan designed for sudden floods and extreme weather events. Evacuating residents during a flood is a complex, coordinated effort that requires specialized inflatables and trained teams to manage swift water logistics. Integrating these steps makes drowning prevention a core component of local climate change resilience, moving beyond the management of simple accidents. Look over your list. You have just translated the WHO strategy into a document tailored to the specific needs of your community. These interventions are proven to work, supported by over a decade of collaborative research and implementation by the WHO and Bloomberg Philanthropies. WHO Director General Dr. Tedros Adhanom Ghebreyesus emphasizes that this responsibility extends across all sectors of society, rather than resting with any single government ministry. Your next step is to take this drafted plan to your local school boards, transport authorities, and community leaders. The theme, Unite to Turn the Tide, suggests that local action does not have to wait for a global mandate. With this evidence-based draft in hand, you have the starting point to engage local leaders and begin the work of securing your community's water.